Good morning. Before we get going, I really want to thank Assistant Deputy Commissioner Yates and the entire City of Philadelphia Fire Department for all of the work they do. Thank you. Hello. And for turning on the microphone. Let's get a hand for that. So I really want to thank the Philadelphia Fire Department for all the work they do, not only in addressing the opioid crisis through the Naloxone Leave Behind program, but also for everything they do on a daily basis. My name is Ray Barashansky. I'm the Pennsylvania Department of Health Deputy Secretary for Health Preparedness and Community Protection. I'm also the designated incident commander for the Governor's Opioid Command Center, which was created in January of 2018 to address the opioid crisis here in Pennsylvania. Throughout my career in EMS, I've witnessed the vital role that EMS providers play, firefighters play, and police officers play in addressing this significant public health concern. My particular career began in 1990, and I was a volunteer EMT in New Jersey for many years. I also had the opportunity to work in Newark, New Jersey as a paid EMS provider also for many years, and I got to witness the opioid crisis firsthand many times over. I also had to witness the devastating effect it has on our families, our loved ones, and our communities, and those lessons are not lost on me in my current position. It's thus when the Naloxone Leave Behind program was actually mentioned, I realized the incredible benefits that it could potentially provide. It was an opportunity for first responders who at times could be chastised for leaving things behind on the scene, as I was, to leave behind some vital medication that could literally save someone's life. Dylan Ferguson, who's behind me, and he's our Emergency Medical Services Director at the Department of Health, will speak momentarily about the importance of the Leave Behind program for our EMS providers and how this public health crisis impacts from an EMS perspective. One of Governor Wolf's top priorities, one of Governor Wolf's top priorities is our opioid epidemic. And here in Philadelphia, and in this area specifically as well, you don't need to be reminded of how serious this crisis is. For a moment, I'd like to ask everyone who's been personally affected in some way by the opioid crisis to raise their hands. I too have been impacted by it, and I have many family members and friends who have been impacted as well. Those lessons are not lost on our Secretary of Health, Rachel Levine, and those lessons are not lost on anybody at the Department of Health. As the incident commander for addressing this particular crisis, I've watched firsthand as 17 state-level agencies and offices have worked together to reverse the effects of the opioid crisis that have affected so many of us. In 2018, more than 4,400 Pennsylvanians lost their lives due to a drug overdose. And while this number represents an 18% decrease from what we saw in 2017, we know there is still much work to be done. We're in the midst right now of our second day of distributing naloxone to the public. And we believe that the public has a significant role as first responders in this crisis. Sometimes it's minutes that can save a life, and it's members of the public who are there to take advantage of those minutes. That's why the administration is providing naloxone to members of the public for free, no questions asked. This effort of distributing naloxone is just one way that we're working to stem the tide of this crisis. There have also been 12 prescribing guidelines for various healthcare providers that have been developed and updated by our Secretary of Health to make sure that healthcare providers are educated on the safest and most effective ways to treat patients who are struggling with various types of pain. Our prescription drug monitoring program has virtually eliminated doctor shopping and decreased opioid dispensations by nearly 28% over the last 2.5 years. Our rescue efforts include naloxone, and we know that we must get individuals with the disease of addiction into treatment. It goes without saying that you cannot treat someone who is dead. There's also a recovery hotline run by our Department of Drug and Alcohol Programs, which has received more than 26,000 calls to try to get people into treatment. In addition, we've pioneered a warm handoff clinical pathway to get those with this disease into emergency room and eventually into treatment. We're thankful for the work that's been done across the state. We're thankful for our first responders, our non-for-profits, businesses, law enforcement, advocacy groups, and so many others who've really done everything they can do to help decrease the number of opioid deaths we're seeing in Pennsylvania. However, one thing you won't see from us is a mission accomplished sign or any sense that we have ended this crisis. The opioid crisis rages on and has expanded to include cocaine and methamphetamines. We have a substance use crisis, and we know it. It's our first responders who time and again are on the front line of this crisis. And on behalf of Governor Tom Wolf, his administration, and our Secretary of Health, Dr. Rachel Levine, I thank everyone here for your work and your commitment in addressing this crisis. The use of naloxone and our efforts to help those in need will be successful. Treatment works, recovery is possible, and we know you're suffering. Please don't give up hope. I'd like to introduce our Director of Emergency Medical Services, Dylan Ferguson, to discuss the EMS Naloxone Leave Behind program.
Thanks, Ray. I also would like to echo Ray's remarks. Commissioner Yates, thank you very much, but also a special thanks to here at There we go, thank you, sir. A special thanks to Commissioner Yates and also to everyone here at Engine 25 and also the Chief George and the staff from AR2 that were able to join us this morning. My name is Dylan Ferguson. I serve as the Director for the Bureau of EMS with the Pennsylvania Department of Health. And like Ray, I too have a significant background in EMS. I've spent the last 15 years either as an EMT, a paramedic, a firefighter, and I had the opportunity to exhibit and to experience a lot of the same challenges that firefighters and paramedics face every day here within the city of Philadelphia. But also, I have a realization that Philadelphia is served by some of the most fine men and women that anyone could ask for to help protect their communities. The Department of Health, through its Bureau of EMS, serves as the lead agency for EMS here in Pennsylvania. Our primary goal is to prevent and reduce premature death and disability throughout the entire Commonwealth. EMS professionals, like all of those that are assembled here today, respond to over 1 million requests for service every year as they work to accomplish that mission. Those calls can run the gamut from a woman suddenly in labor, to a serious car accident, to an individual in cardiac arrest, or to someone who is suffering from the disease of addiction and has overdosed. As EMS providers, our role has been and will be to treat those who are victims. In many cases, we aren't aware of what that final outcome of the situation is, except for those most difficult situations where our work at the scene is ultimately unsuccessful. The opioid crisis and drug overdose deaths remain a leading cause of preventable death here in Pennsylvania. Together, the Wolf administration, led by the governor himself, and also Secretary of Health, Dr. Rachel Levine, have looked at this crisis from many different angles to try to determine how we can save more lives. Within EMS, we have worked to determine what impact our providers are having on those who have overdoses. Our data in the Bureau shows that close to 90% statewide of patients in Pennsylvania who are treated with naloxone by an EMS provider are ultimately transported to an emergency department. That being said, there are many areas where this success is not realized. EMS plays an essential role in the warm handoff process for those patients that are revived and transported to an ED. But for those patients who choose not to seek additional treatment options right now and choose not to go to the hospital, there's no opportunity for that warm handoff to ever be initiated. We have to get the patient to where the help is. At the state, we know that just getting to the hospital and just being referred for treatment doesn't guarantee that someone will actually stay on the road to long-term recovery. And that's why our work surrounding naloxone is so important. More than 24,000 doses of naloxone have been administered by EMS providers across all of Pennsylvania's 67 counties. Add to that, nearly 9,400 naloxone reversals have been conducted by police, and one can see the effect that first responders are beginning to have on saving the lives of those with the disease of addiction. But there's another step further, a step that the City of Philadelphia Fire Department has taken to help save lives. In 2018, when Governor Wolf declared the opioid crisis a disaster here in Pennsylvania, he gave EMS providers the opportunity to leave naloxone with loved ones of those who have overdosed. As we know, in this field, time is an extremely precious commodity. And being able to have naloxone in the hands of those who have loved ones affected by the disease of the addiction affords that person time to be able to get into treatment. Because, as Ray said, if you can't be in recovery if you're dead. More than 1,100 doses of naloxone have been left behind as part of the Naloxone Leave Behind program. Those kits have helped to save sons and daughters, brothers and sisters, mothers and fathers. Those kits have helped save people from all walks of life, people of all races, all social classes, and from all economic states. The disease of addiction does not discriminate, but thanks to the work of you and EMS providers like you across the state, we've been able to begin to fight back. So on behalf of the Department of Health, the Bureau of EMS, and Secretary Levine, thank you for your role in assisting us in our fight to address the opioid crisis here in Pennsylvania. Now I have the pleasure of introducing Noelle Foysen, who serves as Deputy Director for the City of Philadelphia's Office of Emergency Management.
Good morning. Before I get started, I just want to say that I'm actually the odd duck up here because I'm not an EMS provider, but I do just want to take a moment to thank the service and dedication, especially the Philadelphia Fire Department, because I would argue they're the best EMS providers in the country. All right, so now I'll get started. Good morning. My name is Noelle Foysen. I'm a Deputy Director for the Philadelphia Office of Emergency Management. I want to first thank all of you for attending today, but moreover for the participation, expertise, and assistance of all of our partners over the past 11 months as the city looks to combat the opioid epidemic in Philadelphia. I was tasked, along with other city leaders, to work together to solve this complicated crisis and lead the Philadelphia Resilience Project, the city's unified emergency response to the opioid epidemic that brought departments and their partners together in one room to identify needs and gaps in services, access resources, and share ideas and insight. One of the 7 critical mission areas that was directed out of Mayor Jim Kenney's executive order was to reduce overdoses. One idea that was developed out of Mission Area 5 to help save lives, to give people another chance at recovery and their families a chance with their loved one, was the use of naloxone, also known as Narcan. The Philadelphia Resilience Project had focused on Leave Behind Naloxone as a strategy, and through these programs, the city saw a reduction in fatal overdoses last year, with the sharpest reductions occurring right here in the Kensington area. I'm confident that providing Philadelphia Fire Department ambulances with Leave Behind Naloxone to distribute after responding to overdose calls, we will continue to save lives. Reducing overdoses is one of our 7 comprehensive strategies created via executive order last fall. As we approach the 1 year of the launch of the Philadelphia Resilience Project, I look back and am proud of the work done and the people I've met. Thank you for your time, effort, and care for those in need in our neighborhoods. Next, it is my sincere pleasure to introduce Assistant Deputy Commissioner Crystal Yates.
Good morning, everybody. My name is Crystal Yates. I'm the Assistant Deputy Commissioner for EMS at the Philadelphia Fire Department. We appreciate you being here. Today is Pennsylvania's Naloxone Giveaway Day, part of the Get Help Now week. We're proud to be a part of this in Philadelphia. The Philadelphia Department of Public Health is providing free naloxone at 4 libraries today: McPherson Square, Queen Memorial Library, Ramonita G. de Rodriguez Library, and Haverford Library. That will be all day. If you know anybody who wants naloxone for free, please visit those libraries. I want to say thank you for the Pennsylvania Department of Health for being here and choosing Philadelphia to host this event. Commissioner Teal can't be here today. He sends his regards. Naloxone is a life-saving drug. We all know that here. And in Philadelphia, we have a crisis, we have an epidemic, and the state has provided us with naloxone enough to provide to our fire department, the police department, our public transit system sector, the libraries here, the Department of Behavioral Health, the Department of Public Health, and any individual in Philadelphia that wants naloxone can get it for free. We have our alternative response unit here in Philadelphia. I'm very proud of it. It works outside of the Kensington area. This unit is novel, it's innovative, and we utilize a paramedic lieutenant, behavioral health case managers, and a social worker. We work collaboratively to get people right into treatment. As everybody said before us, we do know that people overdose, they receive naloxone, they wake up, they don't want to go to the emergency room. So our alternative response unit is now out there, and they are asking people, do you want treatment? And they are connecting people right to treatment right now. I'm very proud of that unit. I'm going to introduce one of our fine paramedics in a few minutes to talk about it. This week we launched our mobile office that's connected to it. The alternative response unit is behind us. It's an SUV. And the trouble you can see is if you're trying to connect someone to treatment outside of an SUV, it's difficult. So later we'll give you guys an opportunity to look at our mobile office. It's the alternative response unit 2A, and it allows us to take the patient outside of the community and put them into this office so that we can get them comfortable, keep them engaged, and connect them to treatment. I'm happy to be here. We're saving lives. This is the best fire department in the world, and I'd like to bring up one of our best providers along with the case manager, paramedic Taisha Thomas, and Ms. Donna Eccles.
So good morning, my name is Paramedic Thomas. I, along with my co-workers and colleagues, this is our social worker and our case manager. There's one more individual, he couldn't be here with us today. We work every day down in the catchment area, and I will tell you there is a trying days down there. There are a lot of trying days down there, but we will not give up. We will keep pushing, and we will definitely keep fighting. A typical day for us is we'll ride around in the AR2 unit within the catchment area. Everybody asks what is the catchment area. It's usually the area with a high volume of calls of overdoses as far as with heroin or any type of opiates. When I first got down there, my mission was to obviously to get people into treatment. And my first thing was, how am I going to do this? You know, I'm not a social worker, I'm a paramedic. I can save your life, you know. The first thing I realized that we have to build trust with them. We had to build trust, and now we have that trust. They know who we are. Some of them know us by first name basis. We know some of them by a first name basis. Once we got that rapport with them, we have gotten a lot of people into treatment. Without the help of us all together, it just couldn't be done. As far as the Narcan, I think this is the most excellent program that there is. I have seen so many lives being saved. You have business owners, you have family members, you have bystanders who have given Narcan. And it has saved a lot of lives. They really have. And they will flag us down. They will come over to the truck. They'll ask for it. They'll request us. Even though we have that catchment area, we still have other people who know what AR2 is. So they'll call 911 and request us out. There's also people who have different addictions that we also still aid and help them get into treatment as well. I'm excited to be a part of this program. I'm excited that I know that I put in the effort along with my other colleagues of getting these individuals the treatment that they need. I'm also ecstatic about our new AR2A. We come a long way with that. I'm having an individual sit in the back of the car while I do a full assessment, while Donna trying to do her social work issues with giving them beds. But it's coming a long way. We're coming together as a team. It's working. It's a slow process, but good progress, I tell you. I can't put any individual names out or success stories, you know, due to patient confidentiality, but we have had a lot of success. I'm excited once again to be a part of it, and I so thank you, the fire department and Chief Yates for giving me the opportunity to actually be a part of it. Thank you. And I'm going to turn it back over to Deputy Chief Wright.
Hi, my name is Shane Randall. I am the social worker / manager of AR2. Just a summary of AR2. There have been 175 AR2 client engagements since April 22nd of this year, 158 of which have resulted in client acceptance of any services, treatment, linkage to care, information, or leave behind Narcan. There have been 11 repeat clients, or 164 total AR2 clients. AR2 has distributed a total of 182 Narcan leave behind kits amongst the community. AR2 has responded to an additional 214 incidents which have not resulted in or required client engagement, mostly due to incidents that are required / accepted medical attention. Follow-up contact has been attempted with 61 clients. Of the 63 clients initially accepted treatment through AR2, 7 have discontinued or were never admitted. 13 were still engaged or completed care as of a last contact. One client has accepted treatment through AR2 linkage for a second time. 42 have unknown follow-up status. 3 clients have accepted treatment courtesy ride to treatment through AR2 at the time of follow-up. Thank you.
So before I open up for any questions that anyone may have, I really just want to thank Philadelphia Fire Department one more time for having us here, for the incredible effort, and for everything you do every day. Thank you.